and welcome to today's webinar, Building a High-Value GRC Program, a case study of Tufts Health Plan. Before we get started, I'd like to announce a few brief housekeeping details. Today's session is being recorded, and an online archive of today's event will be available a few days after the call. You will receive an email from AHIP that will ask if you would like to receive the archive. Please respond to the email if you would. I'd like to remind you of AHIP's antitrust statement and ask that you reference it in the Handouts tab. The antitrust statement prohibits us from discussing competitively sensitive information. Please keep in mind you may ask a question at any time during the presentation by typing your question in the chat box located in the lower left-hand corner of your screen and then click Send. You may adjust the size of the slides to fit your screen by clicking on the Scale button located in the upper right-hand side of your screen. We're very fortunate to have with us today Carl Paratori, Anthony Metzler, and Himali Nijam. Carl is the General Auditor at Tufts Health Plan. In that role, he leads the internal audit team at Tufts and is responsible for bringing a systematic, disciplined approach to evaluating and improving the effectiveness of the organization's risk management, control, and governance process. Prior to joining Tufts Health Plan in 2012, Carl spent 12 years with MetLife in a variety of roles within the audit department, most recently as Assistant Vice President. Before MetLife, Carl spent 5 years in public accounting working in the insurance, finance, and high-tech industries at a variety of companies, including Ernst & Young LLP. Tony is the Director of the GRC Journey Customer Engagement Programs at MetricStream. He brings over 31 years of software development and implementation experience to the GRC Journey team. As a Senior Consulting Engineer with OmniE Labs, he was responsible for the design and development of an early-stage Sarbanes-Oxley regulatory compliance management application. He transitioned from engineering to professional services after joining Moveris in 2004 and led dozens of successful SOX and financial close implementations from the early stages of system architecture planning through production rollout. Since becoming part of MetricStream team in 2012, he has led implementation and delivery teams for customers in international banking, communications technology, computer technology, U.S. military, retail, clinical research, higher education, and global logistics. Himali is the audit manager within the internal audit section at Tufts Health Plan. Ms. Nijam is responsible for managing audit operations, enabling operational effectiveness and efficiency across the department, including the oversight of our audit management system. She has over 10 years of internal audit experience. At this time, I'd like to turn the floor over to our speakers.
Hi, so this is Anthony Metzler. Today we're going to discuss the core components of the GRC program. We'll do a deep dive into the Tufts audit implementation. We'll discuss leveraging technology to drive accountability, transparency, and efficiency. And then we'll finish off with a Q&A session. So the healthcare industry is in a state of flux. Healthcare is one of the most highly regulated industries, and the list of regulations is endless. Healthcare payers and providers need to comply with a host of regulations, including HIPAA, HITECH, the Affordable Care Act, Medicare, and Medicaid mandates. For organizations operating in multiple states, there can be some specific regulations. Complying with these regulations can be a huge challenge, and it's not only adhering to the regulations, it's about sustaining adherence and keeping track of the changes in regulations. Healthcare organizations need to clearly document their compliance program and provide evidence of its effectiveness. So some of the top healthcare industry challenges. Corporate governance demands. Governance affects how healthcare organizations address everything, right from strategies for patient care to day-to-day operations and the policies, procedures, standards, and processes that govern them. A healthcare organization should do everything it can to mitigate risk and to maintain the quality of patient care. Increasing EHR adoption leading to a greater risk. Many healthcare organizations have undertaken their own IT initiatives, whether server-based applications or simple spreadsheets and databases. And it's not an easy job managing and protecting all of this data. The increase in risk from EHR adoption comes from a number of areas. dynamic and global nature of electronic records, to the growth and the amount of data, to the use of patient portals and collaborative care. There's a very complex regulatory landscape, and we spoke about this previously in the prior slide. Again, the regulations just keep growing and getting more complex. There's been a spike in healthcare data breaches, and they're skyrocketing. Every other month we hear news of millions of patient records being tampered with. Healthcare is a soft target for attackers, as the industry is not as well prepared as financial services, for example. And then preparing for healthcare audits. Preparing for HIPAA, Medicare, and Medicaid audits can be overwhelming and time-consuming. You have to become familiar with the audit protocols, and you need to have all of the documentation in place. It's important to assess the risk and potentially run internal mock-up audits if required. Some of the complexities revolve around a lack of a common taxonomy. And this is really both for business use cases and GRC library elements, such as processes, risks, and controls. There's a lot of difficulty in enterprise-wide reporting. There are too many separate siloed systems and too many pockets of information in order to get a comprehensive overall view. There are multiple compliance initiatives that are all running in parallel on their own tracks, many of which have highly manual processes using spreadsheets. Frequently, there is no centralized data repository, and to some extent, this is due to multiple siloed technologies and some of the things that we mentioned previously. And then finally, there is frequently a disconnect between the risk, compliance, and audit teams. So if we step back and take a look at some of the core components of a GRC program, you'll find that they're based on a number of GRC foundational elements. And this includes things like objectives, risks, controls, processes, assets, organizations, regulations, standards, and so forth. And you'll find that some of the supporting pillars, the first one is governance. And the governance involves many management committees, things like steering organizations. It's tied to the organizational structure. There are a lot of policies and procedures that need to be carefully monitored and followed. And internal and external communication is also very key for governance. Under risk identification and assessment is crucial. You need to determine risk tolerance and the appropriate methods for doing risk analysis. And then you need to deal with ongoing risk monitoring and mitigation. And what's been very frequent is moving into risk-based performance management. And this is a very up-and-coming area. There's a lot of compliance requirements. And leading into that is the need for regulatory intelligence. The compliance environment and process design is crucial to get right. You need to plan for appropriate compliance assessments and even compliance training across the entire organization. And then finally, audit. Is these days now doing risk-based audit planning. It involves different kinds of audit scheduling, resource management, audit execution review, and audit reports. And this all sits really on top of the key concept of needing to have common integrated reporting. So now we'll turn this over to Carl.
Great, thank you, Anthony, and good afternoon, everyone. It's a real pleasure to be here with you today. I thought I'd start first by taking you through just a brief overview of who we are at Tufts Health Plan. So we are a community-based health plan located just outside Boston, Massachusetts. We offer plans across Massachusetts, as well as New Hampshire and Rhode Island, with products being offered within our seniors Medicare divisions, commercial, and Medicaid. We are a 5-star plan. We are also a top-rated plan by NCQA, and we have over 1 million members across each of those plans that I mentioned. So we're what I would describe certainly as a decent-sized local plan, offering a variety of products within those plans to a variety of members across commercial, seniors, and Medicaid. That's just a little bit about who we are at Tufts Health Plan. Our size in context of revenues is we're a little over $4 billion. We have about 2,500 employees, largely located within Massachusetts and some of the neighboring states I had mentioned. I'm going to go quickly. I'm actually going to skip over this because for those who were with us at the onset of the top of the hour here, we had talked about my background as well as Hamali's. So let me jump right into a little bit about my department, so you have a context of the size of my department as I'm describing to you how we're using the tool. So we are 20 people strong within the internal audit function. Internal audit executes audits across all those divisions I had talked about, performing operational audits, financial audits, as well as technology audits. We have associates that have a variety of different professional certifications, some of them that you see here. Most of our folks come to us with a certain level of internal audit experience, and again, they'll be auditing across all of those different divisions I had mentioned. That's just a little bit about who we are, and let me jump now into sort of talking, I think what we're all here to talk about is sort of our GRC journey. And our GRC journey probably started almost 4 years ago now, in 2012. And I had joined just a little bit before that in 2011. And probably what precedes this whole conversation around our GRC journey is when I had first joined the company, I had started the process to do a self-assessment in terms of the department's capabilities, looking at how we go out and execute our audits, the talent that we have to perform those audits, and the technology that we use to enable those audits. In terms of that technology, we found fairly quickly that, we needed something a little bit stronger to help bring us up a level in terms of performance. In large part, what we had used prior to the tool that we had now was what I would describe more as a manual process, a Microsoft Office shop, if you will, where we had Excel spreadsheets and Word documents that largely supported our audit work papers. Recognizing the growth that the business was going through and the capabilities that we needed to deliver to the business, felt pretty strongly that we needed a tool to kind of bring us there. So, the tool that, when we went out to the market to look for a tool, was really born out of that need that we needed a tool to help raise our performance as a department. But also had the eye on that I was really looking for a tool that had the extensibility, if you will, to be a true enterprise tool that would allow me to bring in other functions onto the platform to get to that more of what is a traditional GRC platform. But for us at first it was, what can help us be a better department? And better in the context of how well can we identify the areas of the company that we want to execute our audits in, how well can we manage the plan, and how well can we manage the outcome of those audits, namely open issue management. So our journey in large part started with that in mind. In terms of those aspirations, further, once we got into that journey, as I had mentioned just a few moments ago, we really wanted to focus on installing a tool that would have the ability to look across the organization and help us risk across the organization. So those familiar with GRC solutions, being able to build a taxonomy or a hierarchy within the system that would enable us to perform that type of risk assessment. And then once we were able to execute that risk assessment, drive obviously the creation of the audit plan, and then from there have an overriding platform on which we could then manage all of those activities. And so GRC has been a major, metric stream and specifically the audit management system has been a major enabler for us to do that, building out what we call our auditable entities, but basically our auditable universe, and our ability to risk assess across that. Within the application itself, it further enables us or allows us to deliver a more consistent audit experience. So at the same time I was performing that self-assessment when I first joined, we also went through a fairly rigorous process to redesign our audit methodologies, which actually turned out to be quite a useful exercise before going out to market looking for a tool. And now we had a vehicle or mechanism in MetricStream to then consistently deliver and monitor that methodology across all of the audits that we performed. So we now have an ability to do an effective risk assessment. We have the ability to create a plan, manage that plan, record all of our work, and then from there audit for open issue management. And all the while using it as a means to as we identify the process risk and controls, to add in those regulatory areas of focus. And just this past year, that became even a more important driver as my group team had absorbed our compliance audit function, which previously had been housed within our compliance department. So we now have 4 additional compliance auditors who largely focus on auditing Medicare compliance. So these were certainly our aspirations going into again, this journey. As I reflect back and think about our challenges, you know, I felt like we were in a very good position when we first started this in terms of we had a really good understanding of how we wanted to go and execute our audit methodologies. And for those familiar with the audit methodology or audits in general, we offer a pretty, I would describe, a standard experience in the context that we spend time planning our audits, we spend time executing field work, and we spend time then reporting out the results of all of that work. What we had defined specifically were certainly the key deliverables that came out of each of those phases, the timing that we expected it, and the quality and outcome in which those things would be reported to the management teams. Having a tool like MetricStream certainly allows us to capture that information in a consistent way and to deliver our methodology so that we could then go back and effectively QA ourselves against that. But having said that, we didn't have a system by which we were moving from. So we didn't have if you will, a robust blueprint of the organization where processes were documented, controls were also documented, and risks were aligned to those processes. We were at the point in which we really had to build those out. And so you spend a lot of time, we certainly spent a lot of time agonizing in terms of, okay, how do we want to define that organizational taxonomy? And again, folks that have ever gone through an implementation, any kind of GRC implementation, or just audit management system implementation, there's a lot of different ways in which you may construct that. It could have a organizational focus in terms of the departments. It could have a product focus. It could have a process focus. So we had spent a bunch of time with the support of our implementation partners really trying to figure out how best to kind of set that up. And we knew this was important, not only in the sense that it was going to set up and tee up how we would do our work, but also in the context that it would become the foundation from which others who then would hopefully join us in this journey internally at Tufts Health Plan would also have to adhere to. Because we didn't want to be making frequent changes to that hierarchy. We wanted to put forth a taxonomy that we felt that would grow as we grew with the system. So it took quite a bit of time really trying to understand that and by the different legal entities to get that into the system. And then it was a matter of really building out the process risk and controls. And that's where a lot of our opportunity exists. I could probably look at it in 2 sides of the same coin here. The opportunity to kind of build that out and get that into a system in such a way that will drive the efficiencies within our audit work. But it's equally a challenge because from a workflow perspective, we have to build that out first. So without going, I guess, maybe too far into the weeds here, as we go out into areas that we may never have looked at, perhaps a clinical process, without having those process risk and controls built out within our GRC library, we first have to define them, record them, and then open an audit and pull that in there. So and sometimes it felt like we were taking 2 steps forwards, 1 step back, and really a function in terms of our ability to kind of build out the elements within the system. And I should add, I think this would have been true with whatever technology or platform we went with. We needed to build out exactly what are those processes we want to audit, and then we could go ahead and then audit against those process risk and controls. So that was, certainly a challenge, and remains to be a challenge today, quite frankly, as we go into new areas of the business. The other probably bigger challenge too was everybody, and as I had mentioned, we typically hire folks to come with a certain level of internal audit experience, and a lot of folks come from a variety of backgrounds. Many of them have healthcare experience, some of them don't, but all of them have some level of audit experience. And by definition, they kind of come with their experience, how they've executed the audit. So we were rolling out a brand new audit methodology. We were then launching, not very long after that, a brand new technology. And for some, it was the first time that they've used a technology with this level of sophistication. And understanding that the nuances and just the nuances of the different libraries that they had to manage in terms of the processes, risk, and controls, took a lot of effort to get people up to speed in terms of when they're executing an audit, how they're defining a process, how they're defining a risk and control, so that we weren't being repetitive. So as you might imagine, it took a fair amount of internal governance. And by comparison, as I mentioned before, it is largely us managing this from an internal audit perspective. But having done this at other organizations, it certainly grows in complexity when others are using the system from other departments and they're adding processes, risk, and controls. It's very easy to start to duplicate and create inefficiencies within the system. Certainly, even amongst a single department like us, we still run the risk, and we have governance and process in place to manage that. But that was certainly a challenge in terms of getting the team, all 20 of our auditors, to understand how the mechanics of the system work, not so much how to just click through it and get a control documented in there, but when you should be creating a control versus when you shouldn't be creating a control, and when you should be leveraging an existing process or creating a new process. So we have been along this journey now for a couple of years and continue to grow each year in terms of our capabilities. Particularly excited in terms of the opportunities that lie ahead, in terms of taking really a large, and for those folks that work in the Medicare space, a large and complicated set of CMS requirements, and using the system to help us in a systematic way document those requirements and then go out and audit against those requirements. And just as I had mentioned before, in terms of how we get that into the library, we have now, over the last couple of years, have audited many of those processes where those requirements exist, and we're going to be now further building out those requirements and aligning them to those process areas. So it's been quite an interesting journey. We've certainly learned a lot about ourselves and our departments, and how each year we want to enhance the technology so they can help us better do our work. But that's just, I'll be brief here because I don't want to talk too much and eat up too much of our time, as I think it's best when we have some Q&A, and I can certainly answer any questions that you may have. But that's just a little bit about our story. Again, it was really born out of that need for enabling us to do a better job within the organization, enabling us as an internal audit function to do a better job within the organization, and give us a certain level of effectiveness and certainly efficiency. But also in the back of my mind with that aspiration and desire that as soon as I felt we were ready to roll this out more broadly to the organization, that we could bring on other risk functions. So we could bring on potentially a compliance, we could bring on potentially a vendor management. And the platform is set up, the platform is certainly set up in such a way that we feel we're in a good position to do that. So I will pause there, and I will hand it back to Anthony.
Great, thank you, Carl. So before we jump into the Q&A session, I'll just take a few minutes to talk a little bit about MetricStream, something we call the GRC Journey Program, and some of our applications. So just a little bit about us, right? So our vision really is all about integrated governance, risk, and compliance and quality management for better business performance. We have a number of applications, and we'll take a look at those in a couple of seconds here. But it's across a very broad base and a very wide breadth of different solutions. Currently, we have about 1,800 employees, I think a little bit over that right now. We are headquartered in Palo Alto, California, but we do have offices worldwide. And currently, we're privately held. There's a number of VCs, including Goldman Sachs and Sageview Capital, that have been providing us with funding. And some of the things about MetricStream that may be different is that we actually have a GRC platform with a number of patents that is our underlying base. We are a single vendor that can really address all GRC needs across nearly all industries. We have a lot of cross-industry best practices and domain knowledge that we share with our customers. And we also run complianceonline.com, which is the largest compliance portal that's currently on the web. So to talk a little bit about GRC Journey, I mean, we think of it as a program for customer success. We're very committed to our customer success, and this goes far beyond just the technology that we supply. As a result, we created the GRC Journey program, and we really believe that it will help support our customers by providing them with best practices in GRC program management. If we take a look at some of the pieces, the first component is listed here as GRC program best practices. We call this the GRC Journey Guidebook for Champions, and it contains over 200 different artifacts that can be leveraged for our customers across many components of a GRC program. A lot of our artifacts are crowdsourced from our own customers, as part of what MetricStream has called the MetricStream community. We also have a GRC Journey e-learning course that's been assembled for our customers. It will take around 3 to 4 hours to run, but it really covers the key points of the GRC program best practices from the Guidebook for Champions. We have a number of different special interest groups. I think right now we're holding around 18 where we have regular meetings and sessions. They're done via webinars and GRC TV videos, and we also hold special interest group meetings on site during certain events. There are literally 1,000 different events that we host on an annual basis around the world. This is one of them. So there's a lot. We perform a lot of workshops and events. We work closely with strategic advisors, and it's whatever is necessary to make our customers successful. It's important that we have that we treat partners as treat customers as partners as opposed to just customers. So just to cover some of the core packaged apps that we have that all sit upon an integrated base, things like policy and document management, internal audit management, enterprise risk management, operational risk, compliance, Sarbanes-Oxley, case management, and so forth. Again, we have a very broad base of core packaged applications that have been maturing over the years, and provide a great deal of ability for customers to manage the various GRC initiatives, as well as be able to actually gather data in a consolidated area for reporting purposes. We also have what we think of as MetricStream emerging apps, and they cover things like product compliance management or change management, social media risk management, which is actually a very serious problem these days for a lot of companies. Health and safety, complaints management, NERC, NERC compliance management, and so forth. And just to take a very, very quick view of the way that MetricStream software is really built is there's an underlying databases. It's either unstructured data or big data. We also, again, are keyed into relational databases. There's a, the list of applications, right, are really managed from an underlying platform that includes a set of foundational objects. It includes the infrastructure that sits below it, as well as something that we call Application Studio or App Studio that's actually used to build the individual apps themselves. The GRC platform will support, things like the individual apps, so operational risk and IT risk and case management and so forth. And then on top of that, we can build out vertical or horizontal solutions. But at the end of the day, right, the GRC journey and what MetricStream tries to achieve, it all comes back to business performance. GRC journey is the approach we take to achieve the goals by managing GRC as a program. We've identified that successful GRC program leaders who focus on program strategy, program design, and program implementation won't end up in the ditch. Again, programs that don't really take the time to focus ahead of time and just implement things as individual projects or individual siloed solutions. And again, we have a very large community of our customers that have the ability to communicate amongst themselves, share and leverage, best practices and so forth. So I think what we'll do now is we'll turn this over for a Q&A.
All right, thank you.
Thank you.
As a reminder, ladies and gentlemen, to ask a question, type your question into the chat box located in the lower left-hand corner of your screen, and then click Send. Our first question is from Armando. What was the biggest challenge when building a common risk taxonomy?
Anthony, I'll start. Certainly, as I think about, when we were looking at this, and as we continue to evaluate our taxonomy, but we were setting up that the libraries within our implementation, we wanted something that was really going to be nimble, that offered a certain flexibility, recognizing that the organization was going to change. So we didn't want to set up a taxonomy that was going to tie us into a very specific sort of point-in-time structure, if you will, like from a product's perspective. If we went with the product perspective, we know that our products change fairly frequently. If we went from an organizational or a people perspective, people change quite a bit. So we had felt that the best way to approach this was to be very process specific. So claims operations may change, but fundamentally it's always going to be claims operations. And even organizationally that can move within the plan, but it wasn't going to, the essence of claims wasn't going to change. So we wanted a taxonomy that was going to allow us to be flexible and nimble regardless of what may be happening around us from a company perspective.
All right, our next question comes from Dennis. For those companies where governance, risk, and compliance are separated, how do you eliminate or reduce duplication and overstepping functions?
That's a really good question, and it requires a fair amount of coordination. I'll preface right now that we're not specifically facing that challenge because right now we manage the implementation. But for those, when I worked at MetLife, I use an example, it required a fairly sophisticated governance structure where the groups would routinely meet, and there were certain approval authorities in terms of who could update or enter information within the system. So having established governance in place to help manage those potential pitfalls is critical. Right now, we have the benefit of making our own decisions, and my biggest challenges are making sure that the various plan owners, audit plan owners, that put information into the system don't duplicate us. We don't duplicate ourselves. But when the organizations that use the system grow, you're really dependent on having an effective governance structure to approve and authorize when processes can be added, when risks can be added, and those key elements can be updated.
All right, our next question is from Bob. He asks, what do we wish we knew before implementing MS that we know now?
As I think back, I probably presumed too quickly that the team would understand it, and we probably could have reinforced some of the guiding principles of the system more frequently than we did. We knew some of the challenges about setting up that taxonomy and setting up the classifications. The timing of in which we trained some of our folks was pretty early in the implementation, and then we went live maybe 3 to 4 months later, and we had to retrain. Some of our QA processes, could have been enhanced to look for some of the common areas and where things might have gone wrong. But it's sort of one of those things I would almost say, it's sort of you can communicate 5 times 5 different ways. And in fact, you might want to do it 10 times 10 different ways to make sure that folks are really understanding the guiding principles of the system so that they get the efficiencies of the system and we don't cause redundancies. So we've had certain cases where we've had to back things out because they got entered in twice. So I think, I'd probably put more emphasis on training the team, making sure that they understand not just the mechanics of how to click through it, but the concepts of the system in an integrated GRC system.
All right, the next question is from Bernice. What challenges are you facing?
Some of the challenges that we're facing now, I would almost go back and think in terms of, and I don't know if it's challenge or just the opportunity that's in front of us, but we're trying to go into areas of the business from an internal audit perspective that we haven't gone in the past. And consequently, those processes, risks, and controls that we need to look at aren't defined yet. So in the context of any audit you may start within this system or any other system, you typically go in and pull those elements into an audit and you go audit them. But right now it's a little bit of an empty book. It's a chapter without any words. So we're having to spend some time first going out into those areas that we want to audit, gather that understanding of the process, risk, and controls, get them into the libraries, and then pull them down in. So as you may recall, I sort of mentioned, I feel like we're taking sort of 2 steps forward and 1 step back to get those libraries populated, and then we can audit. We had a decision point, I think it was maybe a year ago, when we thought about how can we jumpstart this. And there is a decision point where you can spend some resources to just start to pre-populate those. But we made the decision that as we go out into those areas, we can go through this exercise to basically start our planning, document our understanding of the areas that we want to audit, then go back and get those inputted into MetricStream GRC, and then start our audits from there.
Thank you.
Good question.
Michael asks, when you refer to taxonomy, what is your definition and what does it include? As taxonomy can mean different things to different businesses.
Yeah, so I would think of it, maybe the easiest way I could describe that is it's the blueprint of how we view the organization. So what are the list of, where are the list of places that we can go conduct audit? So within finance, there's a series of different departments. Within actuarial, there's a series of different departments. Within claims operations, there's a series of different departments. So as I think of that taxonomy, it's more of just a classification of the organizational, the structure and the processes within our plan.
Bruno.
That is a good question, and it's probably worth time spending thinking about, because a lot of folks will call it something one way this way and then another way that way. So it's worth defining those sort of common languages.
Our next question comes from Bruno. How often is it recommended to update or reevaluate a GRC program?
Anthony, I don't know if you have a perspective on that. I don't know that I have a real insightful answer here. I know we always continue to kind of look at our processes internally, just each year in terms of places that we want to improve our effectiveness. But I think the question is beyond that.
All right, our next question is from Bethany. What is the realistic timeline for implementation? Start to finish, where do you feel like the program is running sufficiently?
So let me approach it from this perspective. It took us around, and we're relatively, I would describe ourselves as a relatively small shop. So I think depending upon the size of the shop, this answer is going to change. But we're about, at the time we were implementing, we were about 14 people strong. And it probably took us from midsummer 2013 to the spring of 2014. So let's call that around 18 to 9 months. Even once we got into production, we found that there were certain learning opportunities. And part of those learning opportunities were our better understanding of the system and the technology. Part of those learning and understandings were a better understanding of the methodology that we created. 2014 sort of served as a few of those aha moments for us. And then 2015 is where we really felt comfortable that we've got the system well, we've got our feet well under us, and we could risk assess within the system effectively. We could execute audits more efficiently. There's certainly been challenges and opportunities along the way. So it was fairly quick to kind of get us up and running with a few hurdles there. And I should preface that this story is probably going to change depending on how much you would choose to customize. So we really went with the aspiration of having low customizations. And I would argue not many, very few. So there were definitely things that we wanted to configure, but it didn't require a code change to the system, if you will. I think if you're adding those customizations, you're probably extending that implementation time. So for us, it was probably again around that 8 to 10 month implementation. But then with certain learnings as we went into production. And then by 2015, we were in pretty stable position.
All right, next question from Adam. Does second line functions leverage the tools and framework IA has introduced? If so, can you expand on how you interact with those second line organizations in your framework?
Right now, today, we don't. But that doesn't mean we don't try to have sort of common risk language in some of the taxonomies. So we've certainly aligned in terms of, this was even more particularly important when the compliance audit function was actually in compliance. As I mentioned previously, it actually moved over into internal audit mid-year this year. So it's even, as you might imagine, a bit more easier to manage from my perspective. But I meet monthly with our compliance ethics officer, and we frequently talk about the way in which we rate things within the organization. So as he has compliance issues, so we have a common language in terms of risk in the rating of risk across the organization. But for me, it's a bit of a moot point because we're the only users of the system, and we control all of that common risk language and the definitions within our GRC system.
Art asked, how do you develop control structure?
That's an interesting question, and maybe there's a certain angle to that question. I think for us, internally, if there is something existing that we can leverage that tells us something about the process that we're going to audit, we'll take that and we'll try to build that in. If we do not understand that existing process, then we spend a good chunk of our planning really documenting our understanding of the process we're auditing, as everybody would. From there, really trying to understand, at its core essence, what is the business trying to achieve? What are the things that could go wrong? And how are they managing it? So at that point, we'll build out the control environment. And then we typically will assess it with management in terms of what level of control would we expect to see here given what they're trying to achieve. So, is the balance of preventative controls versus detective controls right? Is the level of risk so low within this area that we can tolerate certain monitoring controls that would detect an event occurring well after it occurred? So I think, that question may come with the classic, it depends. But for us, we try to leverage whatever is there. If not, we have a process by which we can go out to the organization, sort of decompose the business process we're looking at, identify those things can go wrong, and then document what they have in place. But more often than not, the value that we add is making recommendations for controls aligned to their level of risk appetite. We've looked in the past to try to leverage standard control structures, which are readily available from a variety of different sources. They all require some level of customization. I mean, one would argue an accounts payable process is an accounts payable process, and the same risk probably exists regardless of whatever organization you may be auditing. How they implement the controls may differ, though. So there's certainly some value in maybe leveraging existing control frameworks that might be out there, and to some extent we use that. Certainly as we're trying to assess the best practices that we would expect to see within the organization, we often use those control frameworks more as a criteria by which to evaluate the area we're auditing. But we found that we've had to develop them organically mostly.
Now we have a question from David. Did Tufts Health Plan utilize any webinars and or resources offered from MetricStream?
We did. We've certainly tried to be an active member of the community, the MetricStream community. We've gone to the user conferences. We just went to the one this year, and those are quite helpful, not only from the context in which the content, that MetricStream is sharing, but really the users that you get to interact with at those conferences and hear their stories and their challenges. And sometimes it's somewhat comforting. I think a lot of us who are doing any major GRC implementation or even just one module, which we have here, share common challenges. We've also had them come on site, and they were very, very generous with their time. I'm looking at Hamali and can't recall if we've covered any of the specific MetricStreams, but more of the communities and the contacts within MetricStream.
All right, we have a question from Charlie. What feature do you like the most?
I like the ability to be able to put in risks once. So to reduce the redundancies, and by way of an example, centralized security. If I'm looking at process A and they utilize centralized security and I document that, and then I go look at process B and they utilize central security, I don't have to redocument all that work. We just associate that process and those risks with the process that we're auditing. So that is, I think, the beauty of the system in the sense that we get to sort of write it once and use it many times. That's also the challenge with the system. And that's where we run into some of the hiccups where maybe we're duplicating things that we shouldn't, or maybe there's a risk that we're calling slightly something different, but really it's in essence the same thing. But getting that up and running really well is what shocks me most.
All right, thank you. That's all the questions we have at this time. Thank you all for that great presentation and for sharing your thoughts today. Thank you to the audience for participating in today's conference. That concludes this webinar. Thank you again, and enjoy the rest of your day.